Hi, this is Dr. Ganeshakrishnan Iyer, Chief Cardiac Surgeon heading the Aster Group for Cardiac Surgery in Bangalore, predominantly based out of Aster CMI. I'm sure all of you have heard a lot about minimal invasive cardiac surgery, robotic cardiac surgery. I just want to bring to you certain myths around it and clarify as to for whom it can be done and it is safer. Generally, any procedure today in cardiac surgery can be done with a minimally invasive approach. There's no question about it, and it is kind of a given that we try to do all the surgeries with a minimally invasive approach. However, there are certain drawbacks to it, or I would not use the word drawback, you can also use the word certain limitations to it where we cannot actually do it. For example, when we do minimal invasive surgery, we have to cannulate the groin vessels for putting the patients on cardiopulmonary bypass. Now suppose there are disease in the femoral artery, or the femoral artery is very small, or it is the veins are not of a good quality, putting the patients on cardiopulmonary bypass then becomes very difficult and it is unsafe for the patient. Now take for example a patient requires a bypass surgery along with some valve replacement. Now for the mitral valve replacement we have to approach the patient from the right side, for the bypass surgery we have to approach the patient from the left side. Now in this situation, instead of having two incisions on both sides of the chest, it might make it a little safer and also a little bit more practical to approach it with the conventional incision from the front of the chest. So there is a lot of decision in terms of safety that will have to be decided with the patient, looking at all the scans and the reports that are available to see whether a minimal invasive or a robotic approach can be planned for you in a safe way. So now that you have understood the basic requirements to safely conduct a minimally invasive surgery, if any of you have any questions or want to know more about this, please feel free to contact us. I am Dr. Ganeshakrishnan Iyer at Aster CMI Hospital, Bangalore. Thank you very much.